Well, Andrea, when someone is depressed, knowing where to turn to could be the difference between life and death. While resources may be stretched thin in some places, there are professionals working hard to help those in need. Studies show more than 1 in 5 adults in the U.S. live with mental illness. Mental health therapist Kim Criswell says Baptist Memorial Hospital is always prepared to treat those who are dealing with the disease.
We have an inpatient unit where we see patients who come in generally through the emergency room who have a present danger to self or others and are considered not safe to be outside of the facility.
The treatment includes providing group therapy, individual counseling, and providing the necessary medications.
We work with our patients to help them get a better idea of what they need on the outside so that they can remain stable. We talk with them about, what is a better life for you? What does that look like? What is it going to take for you to be more stable in the community? Part of that is that we make sure when they leave that they have the medications they need. We make sure that they have a follow-up appointment, that they're in with someone who can see them. And then, we are available to them. Also, we provide a weekly follow-up group.
Criswell says over the years, funding has been cut back drastically for mental illness resources, which has put a limit on resources available to treat people battling with the disease. But this has not stopped Baptist from being a safe space for the community.
If someone comes into the emergency room and clearly meets the criteria to be admitted to the behavioral health unit, and we don't have a bed, we have people on call who literally place that person. They will start calling every facility in the state. If we do not have a bed, we don't make them just sit there for days in the emergency room. We go ahead and we find them a bed and place them elsewhere because if they're a danger to self or others, they're going to have to be placed.
Studies also showed the number of psychiatric hospitals in the United States continue to decline due to a shortage of mental health professionals.
There are no words to describe how blessed we are and how fortunate we are to have this facility, because there are many people who have to travel a long way to get to a psychiatric facility. When you've got someone who is a serious risk of harm to themselves or others, you need to have them in a safe place. Our goal is to provide excellent care to people, to help them stabilize, help them become more clear in their thinking and able to make their own decisions so that they can go back out in the community and live safely.
Now, Criswell says Baptist treats several thousand patients a year that have some type of mental illness.